together, although socially distant, and able to kind of get together for a conversation related to Stand Against Racism. And we'll dive into that in a second, a little bit more about us as an organization. But I'm Maura Brannigan. I'm the executive director of the YWCA Great Lakes Bay region, and our YWUSA and YWs all throughout the country get together to take a stand against racism this week every year by raising awareness about the impact of institutional and structural racism, and by building community among those who will work for social justice. So Stand Against Racism provides the opportunity for communities across the United States to find an issue or cause that inspires them to take a stand and to unite their voices to educate, advocate, and promote racial justice. So the YWCA Great Lakes Bay region is dedicated to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. We are celebrating our 130th anniversary this year. We've been in the region for a really long time and are working on important issues regarding women's economic empowerment and diversity inclusion across the region. So the YWs across the country this week are discussing how racism is a public health crisis. And we wanted to, and obviously anybody who's been paying attention over the last 14 months have seen the consequences of that and COVID-19. And the focus for today's panel is to discuss how the intersection of health and wealth impacts all communities of color. So it's going to be a broad, wide-ranging conversation, and I'm really excited to introduce our panelists. And I'm going to go one by one here, and I'm really happy and pleased to introduce Sheilda Braddock. She joined Isabella Bank as the Community Development Liaison in 2016. In her position, she focuses on developing and implementing new programs that strengthen the bank's relationships, enhance the bank's role in the community, and brings more of the bank's services to the Saginaw area residents. She is a member of the board of directors for the SVSU Foundation, Samaritas Foundation, and the Saginaw Shiawassee Habitat for Humanity. She also serves on the grant review committee for the YWCA Fund for Women and Children. Previously, Sheilda served as the advisor for the Harvey Randall Wicks Foundation and CEO for the Lamar Woodley Foundation. Because of her long-standing community involvement, she has received both YWCA Great Lakes Bay Region Lifetime Achievement Award and Great Women of the Great Lakes Bay Region Award. Sheilda received her Bachelor of Arts degree in social work from Saginaw Valley State University and is a graduate of the Dale Carnegie Team Development Program, and also has professional certifications in nonprofit management. So welcome, Sheilda. Thanks for being here. I am also pleased to introduce Dr. Vicki Johnson-Lawrence. She is the owner of Johnson Lawrence Consulting LLC, is a consultant of more than 17 years, and providing research and project design and analytics services for clients across the United States. In her current work, she performs diversity, equity, and inclusion analytics and offers tailored and strategic recommendations to improve equitable and inclusive outcomes in professional settings. More broadly, Dr. Vicki is a population and community well-being expert centered in the use of trauma-informed principles to improve health equity. She completed her graduate degrees in biostatistics and epidemiology from the University of Michigan in Ann Arbor, and she has more than a decade of professional experience in higher education. She's also a faculty member at Michigan State University. So welcome, Dr. Vicki. Thanks for being here. Next, we have Pat Franklin-Lindsay. She is the Assistant Vice President at Mercantile Bank of Michigan, covering Saginaw and Midland counties. Pat has over 20 years of banking experience working as a regional community development manager, business development officer, mortgage originator, and now a branch manager. She received her Bachelor of Business Administration degree from Northwood University. She is committed to ensuring underserved markets have access to resources and information needed to build futures. Pat is married to Alan T. Lindsay, and they have 3 sons and 1 daughter. So welcome, Pat. And then last but not least, we're really pleased to have Dr. Pam Pugh along with us today as well. Pam served as the Chief Public Health Advisor for the City of Flint, and she previously worked for 5 years as a consultant with Regeneration LLC, a business owned and founded by Dr. Pugh. Which serves as a catalyst for economically sustainable and healthy urban communities by assisting public agencies, organizations, and businesses in building capacity through effective operations and winning partnerships. So that is our panel. Thank you all for being here. And I'm going to stop sharing the presentation here, and we are going to move into our conversation. So this is kind of a broad ranging kind of scope, and the health and wealth connection is pretty big. But our health is determined by access to social and economic opportunities, and our resources and supports available in our homes, neighborhoods, and communities, the quality of our schooling, the safety of our workplaces, and the cleanliness of our food and water all relate to these social determinants of health. And those social determinants of health include factors like socioeconomic status, education, the environment, employment, social support networks, and addressing these social determinants of health is important for improving health and reducing longstanding disparities in health and healthcare. And so that kind of big overarching big topic is where we're starting today. But I would love to start out with a kind of topic question around, let me see, I'll toss this over to, I think, Pat. I'll start here. And if anybody else wants to jump in on the conversation, please feel free. And I don't mean to assign questions, but I'd love to hear what everybody has to say. The first question is, what do you feel is the most pressing factors affecting access to health and wealth in communities of color currently? And so what are some of the root causes? And you can obviously speak to the wealth aspect of it, but feel free to jump in. What do you think?
Right. I do believe that the social economic status is directly linked to poor health. Lack of access due to income, insurance, directly relates to the different types of diets that we have. Also the type of food that we have access to. And we take a look at the food deserts that we have in our community. All of those are root causes that can correlate the wealth to the health part of it. Depending on our social economic status, if we have health insurance or no health insurance makes a difference if we're going to go to the doctors to get the care that is definitely needed.
Mm-hmm. Dr. Vicki or Sheilda, whoever wants to jump in next, feel free. Go ahead. I want to jump on.
I have this statement. If I want to lower my blood pressure, help me pay my electricity bill. This statement came from a local resident from during the time that I worked in the nonprofit industry. And it remains with me for many years because it so intuitively speaks to the connection between financial health and physical and mental health. If you want to lower my blood pressure, help me pay my electricity bill. And so, there was some surveys that was done by the American Association of Psychology. And, they said 72% of adults worry about money at least some of the time. 26% worry about their finances most of the time. And these connections, of financial stress, to health is quite explicit in the survey. And so, it really does, state that it's not surprisingly that adults with lower incomes experience financial stress. And those who experience high levels of stress related to their finances are more likely to cope by smoking, eating, drinking alcohol, and all of which increase the risk for chronic conditions, diabetes and health diseases.
I agree with what Sheilda just put forward. It's 100% aligned with what we've known for 70 years. This actually isn't new information, but we keep revisiting the same information as though it has changed, as though somehow the facts underlying what causes problems for us change. These specific things are not changing. When your finances are out of whack, your health tends to follow. And it might not be immediate, but it can certainly come much earlier in life that you see health problems rise than if you were able to not be under financial duress for the first 30 years of your life. There's also quite a bit of work that talks about what happens when you don't have financial stability as a child, you don't have economic stability as a young adult. When you're entering adulthood, at least for the generations prior to, I guess, late generation X, early generation Z, prior to those generations, economic stability was thought to be more normal. And now economic instability is the norm. And we see chronic disease rates going up just as we see economic instability becoming more common. So they're closely connected. The data show us they're closely connected. And our systems, our institutionalized systems around the US, they also tell on us and show the same thing.
And if I could just piggyback right on top of what the three have already said, I like where Sheilda talked about the utility costs. And when we look at African Americans, Hispanic Americans paying up to 3 times more than white Americans, home energy costs than others, white households, 3 times more on utility costs. And looking here at the Great Lakes Bay region, some numbers that I pulled. When we look at Michigan's overall income, household income, 57,000 is the average household income. For African Americans, that's 48,000. When we look at and this is Saginaw County rates. I should have did the whole region, but when I look at Saginaw County rates, African Americans make 35,000. And let me go back and repeat those numbers. So Michigan residents overall make 57,000. For African Americans, that's 35,000 in Michigan. Saginaw County, it's 48,000 is the household income, 28,000 for African Americans. And so when we look at those rates, and for Latinos, it's 42,000. Those are huge disparities. And if we're not just looking at the stress of it all, and we know, Dr. Vicki and I know, and some things that we've studied, we know that gets under the skin. Stress gets under the skin. Stress is an suppressant. It suppresses the immune system. So when we look at the stress to disease pathway, we can look at that from a biological standpoint. And I'll just say this on this question is a lot of times we focus, or people, those in charge focus on behavioral issues. And we have to look at the policy issues that landed us here.
Yes. That's all true. And to kind of pick up on your points, Pam, around the impact of toxic stress, and this is, maybe really pertinent this week as well, is with some of the events that have happened this week. What impact does toxic stress and the trauma of racism in daily life and in the media and so on and so on? How does that have effect on people who are impacted by racism? I mean, that can't be great, that build up over time of, so anybody who wants to jump in on that question, feel free.
I can start it. Again, we have the research that shows that stress suppresses the immune system. We know that for moms, that stress and that biological impact can pass through to a unborn child. And so we definitely have the data that supports that. So I'll just start there with responding to that question. And let me just go a little bit further. When we think about how African Americans and Latinos migrated to Michigan, African Americans in particular were escaping the South, the deadly South, Jim Crowism. And then what they were met with in the North, escaping that, looking for better life for their families, looking for better jobs. they often were met with a system that put them in certain areas. And I know Sheilda can speak to this, because when we think about the first ward in Saginaw, there are certain areas that populations were contained, especially Black and Brown communities in particular. The jobs that they came to in escape for a better life were jobs that were the most hazardous to health. And so then what was built on that was housing redlining, pollution, all the things that are bad for health. Topped, with on top, now we have
Mhm,
the continuing effects of that racism
mhm,
that was there. So if the pollution wasn't enough, we can look at how housing was only placed in certain areas for communities, and they were put in those places that we now see are areas that have been disinvested, have had divestment, and other issues that we're talking about now.
mhm,
So when
mhm.
we talk about racism, we can talk about it directly impacting health, but we can talk about the erosion of health over time, the toxic buildup of stress, and the stressful conditions, the stressors that remain in those communities.
Thanks for sharing, Pam. Anyone else want to reflect on this question, or we can keep on chugging along?
I'll jump in and add that, and because of the many things we've learned working in Flint. So I'd worked with Dr. Pam. We worked together in Flint, addressing a lot of mental health fallout in an effort to build resiliency in the positive way, not necessarily. I'll say there are different forms of resiliency, and this also applies to health, and it also applies to finances. When we talk about being able to withstand something, people say you're resilient. And then when we talk about being able to thrive in something, we also use the word resilient. But when we're talking about trauma, the capacity to be resilient is not necessarily something you want to be known for. You don't want to necessarily be known for being able to stand through every bad thing that has happened in your family lineage for decades. And so as this conversation unfolds and we think about traumatic histories, this week included, I'm wondering, what are we going to do differently culturally that lets people get on a level playing ground with all of the people around them, the people that they live with, the people that they're integrating with, the people who they've been previously segregated from, but expected to succeed and compete with? When are we going to be in a space where we can all somehow be level? And it doesn't mean equal. This is equity I'm talking about. But how do we get there after such a varied impact of trauma over time? Yes, we're all resilient in different ways. We don't necessarily want to keep being resilient because we have to. We like to be resilient in the spirit of getting better all together. So I'm very sensitive to the idea that we can all just keep making it. And when I think about the neighborhoods that Pam just described, the people who live there, they've managed to live there. They don't need to thrive there because they can. The goal is to excel there, change the environment so that they are building upwards, not just holding on for dear life.
Mhm.
So I'm looking forward to the times where we are not holding on tightly just to make it to the next day, but instead moving forward in a successful, thriving way. And with everything that's happened this week, I have the same spirit. It'd be great if our systems didn't suggest that we just had to hold on and kind of pick apart the parts that we can hold on to or to be thankful about, and all of the bad things that happen. It'd be nice if we were just able to be thankful for good things in general. Not wishing that this part of the system wasn't broken, but we can hold on to this other piece. And reform is not the right word, but defunding might be the right word, but not in all the situations. We have to do too much parsing of our language and too much nitpicking over which version of resilience we're willing to hold on to. I would love for that to change as we talk about addressing trauma over time.
Beautiful, thank you. Well, we can keep on working into, I guess, drilling into the questions around health. What are the most pertinent public health issues impacting people of color, people in the Great Lakes Bay region, things that we might not be aware of? I mean, obviously, COVID's obviously a no-brainer right now, but what are some of the other public health issues that are kind of sticking out there? And this could be Dr. Vicki or Dr. Pam or anybody else on the panel who wants to talk about this.
I will jump in, and Amora, I have not looked specifically at our most recent health improvement plan and assessment that has come out, but I will tell you, whether we're talking about cancer, whether we're talking about heart disease, we know that African Americans and populations of color, infant mortality definitely impact us far more gravely than other populations. And I think that being detected, early detection when we're looking at cancers, breast cancers, getting the care that we need. I just had an experience where someone who I know very, very close had a horrible experience in childbirth, which mimics some of the things that I listen to and read about, but happen in real life. I think we really, if we look at COVID, one of the things that has been so disheartening to me is that after all that we've learned, all that we talk about, addressing the needs of populations of color has still been an after effect. It's been that, that population, we see the numbers are way skewed and way off the charts. What are we going to do now? Versus this is a population that typically has all the conditions that we know that they're going to be impacted the most, whether it was getting the testing, whether it's because we know that they usually work the frontline jobs, whether we know that they have the underlying diseases, whether we know that because of access, because of trust issues, that we need to make sure that we're putting vaccine in their communities, whether or not there's been no investments in the school systems or the school buildings. So we know that those environments are going to be worse. So I think a lot of times we're afraid to say black, white, that black people are going to be hit harder. So let's address them. And we think in a colorblind society that we can't say those things. But when you do that, you are allowing racism to perpetuate, or the racist systems to perpetuate, or the structure, the infrastructure that this country was built upon to perpetuate. I hear the numbers of COVID testing or 50%. That's a marvelous thing to celebrate. But if you look at subpopulations, we're seeing something totally different. We're seeing something around 4% having a first vaccine, 2% for Hispanics. So I really think making sure that it's not an afterthought, but we're having these bold conversations like we're having now, and people are not afraid to say that, hey, we're going to have to step out there and let the data drive us to support and do everything that we need. And to Dr. Vicki's point and Pat's point, we're not talking about equality, we're talking about equity, and we have to be able to do that.
Wonderful. Perfect. Thank you. I will toss this question to Sheilda. This relates a similar bookending question to the one about pertinent public health issues. What about pertinent economic issues impacting people of color in this region? Unemployment due to COVID shutdowns, things like that. Obviously, anything else? Anything that other folks might not be talking about? Again, trying to have these bold conversations about things that aren't being discussed.
Yeah, so when we think about those things that are impacting people of color, I want to focus on the racial breakdown. In the city of Saginaw, it is a major minority, with white people making up maybe 44% of the population. But the largest racial group in the city of Saginaw is African Americans at 45%. And so outside of the city, the county is much more heavily white. And so this geographic clustering of African Americans and other people of color is really a legacy of systemic racism in itself. And it also results to other inequities that Dr. Pam mentioned as well. And so even income, you know, the median income household in the city of Saginaw has decreased from the years 2000 to 2018 by $812. And of course, additionally, you know, the long-term effects of COVID-19 pandemic will also lightly affect the median household incomes for years 2020 and 2021. And of course, the housing supply, which is a big concern in general. You know, the city of Saginaw's housing stock is aging, with over 93% of homes aged over 50 years old. However, in surrounding communities in Saginaw, only about 16% of the housing stock is comprised of homes over 50 years. And so some of the complications that arise within an aging housing stock can include cost prohibitive maintenance, upkeep, you know, such as structural or foundation repairs, heating, cooling equipment replacement, and other challenges. And this really makes it really difficult, you know, for our low income families. So, and one other area, you know, in terms of the city, we really need to attract more employers, but how can we do that when some of the basic services such as grocery stores and medical centers and affordable housing, you know, is an issue.
And what do you have? Do you have anything to add, Pat, or anything that that you've seen day to day, or anything that we haven't discussed?
When we think of the disparity that we have in our racial divide with income, we can definitely look at the impact of having negative wealth. If you have negative wealth, of course, that's going to lead to, you know, for every $5.04 that a Black family may have, that same dollar is worth $100 in white family households. Unfortunately, with most Black families, we start out with negative debt. We get what we call bad debt, mostly credit cards, you know, that's used to purchase items that we usually should be paying cash for, and then not being able to pay the bills off at the end of the month, versus with maybe more white family households being able to have good debt, you know, being able to purchase home ownership and build that wealth and create wealth to move forward. Those things, if we were able to learn them at an earlier age in schools, because we did talk about improving the school systems, that would be a great plus to being able to help us to fill in that gap. A lot of these things we learn trial and error. You don't learn it in your households. So it definitely impacts us as far as being able to create wealth, and even to do some of the maintenance that Sheilda talked about in our housing, being able to age. It's not so much that it just ages, but it's more so that it just begins to fall apart because we don't have the money to take care of the homes and the upkeep that we need to have. Most homeowners may have purchased a home 30 years ago and they were working. Now they're no longer working and can't afford to do the upkeep because now things are starting to fall apart, which causes us to have issues in that manner. So.
Okay. Great. And this is a big question, and I can, Sheilda, Pat, you know, Dr. Vicki, Dr. Pam, anybody can jump in on this one. Solutions for closing the racial wealth gap. Do any of you personally see any viable solutions to building resources and wealth for people of color? Is there an easy solution? I'm sure this is not an easy question to answer, but I think that this is something that's really important, needs to be discussed. Closing the racial wealth gap.
think that is definitely not an easy question to answer. However, there are programs that we have out there. In one in particular that I'm involved in with the Saginaw Housing Efficiency Program. We help individuals who are on public housing become self-sufficient. And we're able to do that through education. We educate them not only on financial literacy, but how to go out and obtain a job. And we start them from point A. We assume that level to get them to the point where they are self-sustained and they're able to get off of welfare that may have hindered as a security net for many years for a lot of families. I hear all the time that drop out of the program once they get close to getting off of the system because they're afraid that it might not be there for them if they should fall. You know, what happens if I get this job and I'm making this money and now I'm in that Alice population, but I can't get the help and assistance that I need anymore. So we find some people that'll fall back out of that fear because they've never been on the other side to see what it feels like to be middle class and not to have that help and assistance. There's a safety net. Of course, we start teaching financial education where they can start saving money, you know, consistently is what we say, you know, start with change and then make it turn into dollars, but be consistent with whatever you do. Think short term first. On finances, things that you can handle, things that you can take care of, and then look at long-term options, you know, the importance of having life insurance to build wealth and investing in retirement plans. Those things are all important, but if no one's ever talked to you about getting old, you don't think about retirement plans. It's hard to think when you're 20, you know, what life is going to look like when you're in your 60s. So a lot of us have not learned that in our homes. And so therefore we don't invest in those retirement plans when they're offered to us. So just starting small, getting their education is important. You know, we need to start stressing more the importance of education. It makes a huge difference in our income levels. You know, on average, if you have only a high school diploma, you're going to make about $592 a week. Versus with an education, you could take that up to $887 a week. So it shows the difference between the levels and knowing that there's more than maybe even college out there as opportunities. There's skilled trades and there's entrepreneurship. These are things that we could bring into our school systems at an earlier age to give people options because not everyone wants to go or attend college. And so the more opportunities that we give them, the better off they're going to be just to be able to build wealth and close that gap.
Yeah, and so in addition to that, Pat, yes, you really covered quite a bit of areas of focus, but certainly, you know, we need to focus on investing into new businesses because we also must invest in small businesses. Not only are they important mechanism to build financial health, but small businesses also create, you know, 2 out of 3 jobs in our country. And also expand access to financing those entrepreneurial trainings as well. And we spoke about the increased wages. You know, a major driver of the racial economic gap is household income. And people of color, they're overrepresented among minimum wage workers. Currently, the federal minimum wage is what, $7.25 an hour? A full-time minimum wage worker earns about $15,000 a year and $7,000 below the federal poverty level for a family of 3. So raising the federal minimum wage to $15 an hour would certainly improve the overall standards of living for minimum wage workers. And these workers, again, would be able to easily afford their monthly expenses, such as their rent, their car payments, and other household expenses.
And if those are really great points that Sheilda and Pat brought up. I think one of the points that Sheilda just brought up and Pat just brought up is we have to make sure that we don't have systems that are encouraging people to check out of society. Meaning, as Pat just mentioned, and Sheilda mentioned, if they can't make a livable wage, why would they risk coming off of the system if it's going to be to their detriment and their family's detriment, which it definitely can be. Um, I think the small businesses supporting folks with entrepreneurial minds, especially at this time, and I'm so happy to see that Beth on the call and has definitely been a part of arranging this panel. Um, and I think we can talk about budgets for people, but I know myself, I'm not really that interested, or in the past, I was not really that interested in a budget when I was living just, from day to day. I won't even say paycheck to paycheck, but we have to provide opportunities for people, work opportunities. And it's not just having the job there, it's also making sure that you have an atmosphere and that's conducive for, that's welcoming to other cultures. And in our region, we have a deficit there. I hear people say, hey, we want to hire a Black person, or I mean, no, they won't say that. We want to get diversity. And the setting is not there. The table's not set. I wouldn't even send a person to certain organizations because I already know that it's not going to be a match. There's some work that needs to be done within that organization. And I will say to organizations, if organizations have gotten comfortable with just white women, just white men, just uh, vice versa, you need to be becoming uncomfortable with that, with these numbers that we're giving you, and with the unemployment numbers, and as we said, people checking out of society. We need to be more uncomfortable when we see that there are people missing from the table. And then we also need to be making sure that that table is set for people to come in and feel welcome. And you're not bringing them in to conform, you're bringing them in to bring a different set of thoughts. Obviously, you have a business and everybody needs to be about the mission of that business, but think about how you can other people coming into a business can help that community be more culturally diverse and be more welcoming to other people with different mindset, different skill sets.
The addition I'd like to make to this conversation is in thinking about the minimum wage. I have some really great friends with small businesses, and they are desperate to hire people at the minimum wage in order to make the business work, because that's the only way the business can survive. But then the people who work there can't only work there. It means there's higher turnover. They're looking for other jobs with higher pay. It means people can't stay in the workplace. They can't stay in the workforce, and there's no opportunity. There's no space to fall, is what I would like to put on it. So it's wonderful that people want to work, but if our system suggests that you are worse off working, and worse off working, even if you work 2 full-time jobs at minimum wage, you still are not okay.
Mhm.
At what point do we recognize the health fallout that comes with that versus acknowledging we have to do something different? I am nervous that we'll continue on a path where small businesses will continue to say, I don't have people to hire. People don't want to work, because we're seeing these signs everywhere right now. People don't want to work. People just don't think work is important. And that's not at all the case. So there's a mischaracterization of the problems, and we're having one group of people pitted against the other. So we have small business owners pitted against potential employees, and potential employees protesting against businesses, when it has to work together. We have to find a way to go forward and let it be different. And thinking about something Pat said earlier about people with lower education being the persons who were in the lower wage positions, until we find a way to adjust how we think about the value of people's roles and positions, even if they're not what we might consider to be prestigious, we're going to continue to have problems. And that's also that also happens because of how we value other people's bodies and how we value other people's brains and what they bring to our communities. So in listening to all three of our other panelists, I am wondering, how do we make sure people's lives get valued, which is pretty much the whole racism or anti-racism movement.
Mm-hmm.
How do we make sure that the economic value that we implicitly place on people's heads gets reconciled? It needs to be, if something's going to be reformed, that needs to be reformed because it applies to people from all different backgrounds. And one thing that Pam said earlier about having a very homogenous room, a homogenous board, I would love for us to all be uncomfortable with it, whether it's homogenous in any particular domain. But then there also has to be an acknowledgement that those spaces, some of those spaces exist to balance the other ones that exist. So we get all brown rooms and all women rooms because there have been all white rooms and all male rooms. And either we acknowledge that as a whole, we have to accept each other. But until then, what do we do? Do we, I'm looking even at this group and I'm thinking, man, it's a lot of wonderful people in this group. Where are the men? And I do see men, so please forgive me, but where are the men who are championing these issues just as loudly as the women will champion these issues? And I've had this concern when thinking Black, white, women, men, cisgender, non-cisgender, all of those different dimensions. Where are, sometimes we call them allies. I'm weary of that phrase, but where is it? How do we do it together, recognizing we got to have those separate spaces for everybody to kind of get it out and exist?
And more, if I could just add one more thing to what everyone has said, because this issue of education has been touched upon, I think, by everyone. And in our state, in the state of Michigan, we fare the worst when it comes to adequately funding our education system. So I just want to put that out there because I think, to Dr. Vicki's point, Pat's point, and Sheilda's point, if we are saying that we value the lives of our people, specifically our children, who then will grow up, and we want them to have all the wherewithal to be able to hold a job, to get a job, a livable wage job, then it has to start there. So that's another policy, a place where we have to apply pressure in an area of policy, because we can't expect different on the behavior end if we're not performing adequately on the policy end.
Perfect. To kind of jump back into a point that was made, and I think we've all kind of touched on it, how would you suggest or support people to hold on hope and build resilience while they're working towards making these vital fundamental changes? There's a lot of the women in our programs, maybe on support programs, are trying to make that transition to working full time when kind of experiencing a lot of the questions that, or a lot of the problems that Dr. Vicki just mentioned. How do we kind of motivate, or not motivate, but like encourage, support, celebrate when folks are kind of stuck and they need to kind of so I might have stopped talking. Anybody want to jump in on that one?
Well, this is Pat. I would say that one thing that we need to do a much better job at, not just with our women, but with our children as well, our youth, is building self-esteem. A lot of things is surrounded because we don't value each other. And we've already talked about that. When you've been used to individuals putting you down, or a group of people bullying you over a period of time, it takes away that self-esteem, and it makes you want to shrink more into the background. So the less you shine, the better off you are. And so if we could find a way to, even in back to our school systems, to build people up more, to give them that support system. I mean, it's a part of my daily job that I do as a branch manager with my own team, is just making sure that I continually build them up, and, always finding the sweet spots. And you touch on the negative because it has to be addressed, but at the same time, you point out the good parts and where you could have a learning curve in there. So I feel that if we could as a society, the old saying, if you could say one thing nice about a person on a daily basis, we all would be much better off. I think that has a lot to do with the way that we value and look at ourselves, people.
Beautiful. Wonderful. Well, thank you. I'm going to move into our kind of sum up question. And so if I've got a couple different options of how we can talk about this. What steps can concerned community members do to support change in these areas, or outcomes that we should be pressing from our elected officials or our community? How do we hold our elected officials accountable? I mean, we've talked a lot of, again, broad, big topics and some really very, very important topics and points that have been made. What can we do? What can we do now? We've got a group of folks who are motivated in the room here today. What should we be talking to our elected officials about, and what can we do to help support change?
When we talk about the outcomes, we spoke on many different areas in terms of financially secure households. I think that should be one of the outcomes that we want to focus on, as the dollar spent on financial education, financial stability. I know we have our group Thrive that is taking a lead on that. Dollars directed to income tax filing assistance, those all would focus on the financially secure households. Having equitable local and minority hiring, affordable housing. I think one other one, health community residents, dollars spent on public health initiatives. When we think about our infrastructure here in our community, grocery stores is one of the areas of inequities that we find within the community. So I think these would be some good outcomes, that we could focus on and pass on to our elected officials.
Perfect. Thank you. And anybody want to go next? Dr. Vicki, Dr. Pam, Pat?
And we're doing our closing remarks.
Yeah, kind of what do we kind of want to, what should we be doing next? Yeah. And
I think there are some people in the community who are doing some good work. And I lift up Beth. I see Jamie Forbes on the call and some others, but just really, I looking at the information, again, being okay with being uncomfortable, and making sure that we're just not ignoring those signs once we see them glaring at us. I think one of the things that as we see ourselves rebuilding, and I hope that as COVID has brought to light this whole cross section, or this intersection of health and economics, and that we hope to be better on the other side of COVID. We have to be careful, because we know that sometimes when we rebuild, we can be even more exclusive, less inclusive. There's this word called gentrification. I recall as the city of Saginaw began to rebuild, and there was the changing of two of the buildings, the apartment complexes that were for lower income and persons with disability. When they rebuilt those buildings, there were some people who were displaced. Some people were okay with it. Other people had an issue with it, rightfully so. But I remember the billboard to attract people to move, white couple, and I remember several people brought that up, like, does this mean that the people who were there before aren't welcome? So I think just recognizing those things and making sure that as we rebuild better, that we really rebuild better, meaning that we are more inclusive, that we don't leave out those people who struggled in these areas that could easily be displaced. When we look at businesses and small businesses that have struggled, we know that in April of last year, across the country, 40% of Black-owned small businesses closed in April. So as we rebuild back better, that we're thinking of being inclusive and doing whatever we need to do to put ourselves in that uncomfortable space, even to make sure that we're creating that environment and that we're really intentionally being more inclusive. And thank you. This was a great panel.
Beautiful.
Thank you for
Yeah,
having us.
thanks.
Yeah. Well, this is Pat, and we definitely have touched on a lot of different topics this morning. And just one that we did not touch on just quickly is mental illness and the disparity that we have there with how Black and people of color view the term and unfortunately want to avoid the label at all costs. So therefore we don't seek out the help that's needed in our community. So just being able to possibly seek out programs that's going to help us to be better. It would be great to have a resource that could tell people, okay, if you need financial literacy here, these are different nonprofit organizations or agencies that can help assist you with that. If you need mental illness, I recently talked to someone about that, and the problem that they had is they had a therapist, but the therapist did not relate to them. So making sure that we're doing a better job at matching up individuals based on their need, because that's a huge, unfortunately, it's a huge gap there. And it could turn people away, and that one story could carry throughout a whole community and make an entirely different opinion of how they view that.
Perfect. Beautiful. Thank you.
I would like to suggest that we be open to change in young adulthood as a major way forward. And the reason when I say open to change, I mean being open to doing things in a different way. I feel like I'm noticing generational shifts. A good deal of my work looks at what happens as people age, and not just age in the becoming older, over 65 way, but as the generations encounter new economic situations, they are forced to live a different economic reality until they hit some age where they feel like they kind of fit in with what their parents said or what their grandparents did, or they feel like they're old enough to own or rent or whatever. When I think about ownership, I'm thinking about wealth. I'm thinking about this entire conversation from a perspective of wealth and having racial equity in wealth. If younger generations can't buy homes as early as their parents, and they don't make enough money to support buying a home in their 20s or early 30s, and they have extra debt that they can't pay off, then this young adult period, our early 20s, seems like an optimal time to talk about doing things differently and changing our approach to how we understand money and how we understand building wealth. In other words, before you have a lot of people who are dependent on you and dependent on your money to live from month to month, that's a prime time to think about entrepreneurship. It's a prime time to think about what can I make, sell, build, create, design, consult for, and share that will let me live the life that I'm going for, since $7.25 an hour is never going to do it. And even with the higher education, so to speak, it doesn't necessarily bring you to a place where you can afford to buy a house, pay student loans, pay for a car, pay for life insurance, pay for your kids to go to preschool, or be on the borderline where you can kind of afford it, but not quite, and feel frustrated and stressed out. So I would love for those of us who work to educate young adults, early 20s, before people are super dependent on you, to be okay investing a little bit of whatever you have in yourself so you can make, create, build, share, consult, design, provide to others for the next 30 years. That was something my mom showed me, not on purpose, but it's how I became a consultant. It was the very first thing that I ever did because I used the skill that I had and didn't really know it was a skill that people would pay for. And 17 years later, it's the skill that I can use to support myself independent of working for an institution, independent of working for other people. I can work with other people, but not for or required to, you know, have a certain number of sick hours to be able to take care of my kid, certain number of days that I can take off to manage with my family while my kids go to school, or we're in the middle of COVID, or my parents are sick. All that is the stuff that will take you off whatever path you thought you were going to be on. And it'll take you off quickly.
Mhm.
So embrace the change and be okay as young people try to come to us and tell us what they think, even if it's not normal and not traditional.
Perfect. Beautiful. Well, thank you. We've got about 3 minutes. I really want to be dedicated to ending this at 1 promptly, you know, to respect everybody's time. And thank you for all of the wonderful topics. We could probably go off in a million different directions of questions, but if anybody in the audience has a question, we'll see if we have time for more than one, but feel free to unmute yourself and ask away. Any burning questions out there? Well, I'm not hearing any right now, so I will begin with the thank you. And as Pam mentioned, thank you to Beth Rosaticky, who is our board chair right now, and she's also was very instrumental in planning and kind of advocating for this topic. So thanks, Beth, for helping, and also Dr. Pam Pugh for kind of inviting all of the panelists, Sheilda Braddock, Dr. Vicki, Johnson Lawrence, and Pat Franklin-Lindsay. Thank you all for taking time out of your lunch day, out of your Friday to come and spend time thinking about these hard topics. And I think this has been a wonderful conversation, and I've learned a lot, and so much that we need to keep working towards. And if anybody else is interested in another Stand Against Racism panel discussion on Monday, the 26th, we'll be talking about Stand Against Racism, calling in or calling out, featuring Dr. Amy Beasley, Amy Phoenix from our staff, and Erin Patrice of the Breaking Bread Village. And that should be a great conversation. So enjoy your weekend. Thanks again to our panelists. Thanks to everybody for attending. Have a wonderful rest of your day.
Thank you.
Thank you, everyone.
Thank you.
Thank
Have a
you.
great day.
Thanks.
Thank you so much. Take care.
Thanks, everyone.
Thanks.